I'm presenting on the topic clinical benchmark. I will be sharing with you the solution to question 1. So what is benchmarking? Benchmarking is a continuous comparison and measurement of a person against his peers in order to improve the person's efficiency, and this can be done in business and similar situations. So for clinicians, this is used in comparison of multiple clinicians, especially with patient characteristics such as length of stay, among other patient characteristics. And this is done to improve the effectiveness of clinicians. So this is the question, and so I'm going to be using SQL to analyze the data. This is the Excel spreadsheet of the data, and we are comparing Dr. Smith and Dr. Jones. So looking at the description of the data, we have different rows that looks at the patient's outcome, and we are also looking at conditions such as myocardial infarction, congenital heart failure, shock, and the outcome variable is length of stay. Then the clinician column indicates patient cared for by the clinician. So the first step we're going to do is just to, in SQL, after loading the data, is to change the data type from varchar to float. This is what I've done here. Then the second step is to calculate the pattern of care for Dr. Smith. And this is the code also. You'll notice there are 7 patients that Dr. Smith is taking care of. And for the next step, we are looking at the pattern of care for Dr. Jones. And this is the outcome. And it stops, the code stops at from temporary table pair, and you see here that the Dr. Jones is caring for 8 patients. And so we have to join both tables we have to match both tables to look at the table as a whole and match them based on their morbidity, which is on common strata. And that's what was done in this slide. This is like the extended version of the slide. And here we are trying to, in this part, we are trying to remove, calculate synthetic cases for missing values. And that was what was done here. Then for answering the sub-questions for question 1, I had to do this in looking at the probability of the outcome or the effectiveness of Dr. Smith in Smith patient, Dr. Jones in Smith patient, Dr. Smith in Dr. Jones patients, and Dr. Jones in Dr. Jones patient. And this is like the SQL code for that. And this is the outcome. And so in conclusion, when Dr. Smith, the expected length of stay when Dr. Smith sees Dr. Smith's patient is 3.74, and when Dr. Jones sees his own patient, that's 4.6 days, 6-7 days. While if Dr. Jones sees Dr. Smith's patient, length of stay is 0 days, while if Dr. Smith sees Dr. Jones' patient, length of stay is 4.07. Thank you. Thank you for listening to my presentation.